I'm Gaural Patel. I'm a consultant oncoplastic breast surgeon, which means that I specialise in all aspects of breast care. My main focus is on cancer treatment, and I am also a reconstructive surgeon, so I try to treat cancer in a way that leaves the breast as natural as possible afterwards. I've been a consultant surgeon at Milton Keynes NHS Hospital, and I qualified from Oxford University many years ago. But following my higher surgical training, which is when I decided to specialise in breast care, I did a national oncoplastic, it's called a TIG fellowship, but it's an integrated plastics and breast fellowship that allows me to offer all the reconstructive options that I can. And then before I took up my consultant post, I went to Paris and I did a fellowship with Krishna Clough, who's one of the founders of oncoplastic breast surgery, which was really inspiring, and learned lots of tips and tricks from there. I was always quite creative at school and arty, but then ended up being surprisingly good at science and ended up in medical school. But actually I loved it. I got there and I was absolutely fascinated. The human body is incredible. And pretty soon in medical school I realised that surgery was what I wanted to do, because I could do stuff with my hands, which was brilliant, and that linked in with all the other biological stuff that I was learning. So I knew I wanted to be a surgeon right pretty much from day dot, and discovered breast surgery while I was a higher surgical trainee, and actually loved it, because the women who get it and the men, they're just normal people like you and I, and it's not that they've done anything wrong or not looked after themselves. They're just normal people who unfortunately have got this really common cancer, but one that I can do something about. And I think that's why I really loved it, because the treatment and outcomes for breast cancer are so good and improving all the time. And then on top of that, I think the first couple of mastectomies that I did, I thought, okay, great, I can cure somebody's cancer, and that's wonderful. But then I felt a bit like it was mutilating surgery, and I didn't like that, and I didn't know if I could do that. And then I discovered the oncoplastics and the reconstruction and all the neat ways that I can conserve breasts. And then I just fell in love with it. Didn't look back, because I can now cure cancer and actually give people really good cosmetic outcomes too.